This is Dr. Ching-Lynn Chen of Westside OB-GYN.
OB-GYN Westside.
OB-GYN Westside, 212-580-3866. I know her number because I refer everybody to her, and she delivered all my kids, and she is also my doctor and a menopause expert. So thank you for all your questions. We're going to start a big series with a bunch of amazing experts, and I'm so psyched you're our first expert, and you will be our continued expert during this whole sequence. Is that good?
Awesome. I'm excited to be here.
Awesome. So the first question was, I am 55. I've been using compounded HRT cream or gel, and how long can I use it? So let's break that down into what is compounded HRT cream or gel, and then the second question, which is harder, which is how long can I use it?
So I think what the person's referring to, compounded gel, is probably a custom-made combination of estrogen and progestin cream or gel that you put on your skin.
Is it anywhere?
Usually inner thigh or upper buttock, usually just anywhere. Some formulations you can put on your arm. It really varies a lot. I'm not sure exactly, which one. And I'm not exactly how the quantities that's in it too, because it can vary. And there's no real data on how long someone can take it. There's risks to taking long-term hormone replacement, but there's also benefits. So it really has to be a very individual decision made with the doctor.
Cool. Okay, let's take a step back and go into why is the field of HRT something kind of new? It's old new news, and why is it so confusing for all of us?
So it's been controversial because around 2000 there was a study called the Women's Health Initiative, and the hypothesis of the study was that putting women on hormone replacement, which is a combination of estrogen and progestin, would reduce their overall risk of cardiovascular disease. And we always knew that taking increased hormones might increase hormone-related cancer, so that wasn't really up for questioning. It was more that maybe the cardiovascular benefit would outweigh the cancer risks. And when they did the study, they actually found that there was no cardiovascular benefit, and that it just reproved that there was an increased risk of breast cancer. And when that data came out, the study was immediately stopped, and hormone replacement was essentially just, what's the right word for it? Stopped. People basically freaked out. And the risk is still there, but now there are other unquantifiable benefits, like for hot flashes, or some people it's skin or sleep or mood swings, and there's some studies to suggest that it reduces your risk of dementia. It definitely reduces your risk of osteoporosis. So that's why it's not necessarily an everybody should take it or everybody shouldn't take it. It really should be an individual decision depending on what the benefits are that person would get.
So I remember reading that New York Times article, and they were saying that the risk of breast cancer, which is breast cancer and endometrial cancer, are those the two big ones?
Well, an endometrial is really only if you take estrogen by itself. So if you take progesterone with your estrogen, then endometrial or uterine cancer should be pretty minimal.
Okay.
The risk, so mostly breast.
Okay, so we're going to come back and we're going to talk about what exactly is that risk of breast cancer, because I feel like that's the nugget in all of this. So what we want to talk about with HRT is this potential risk of breast cancer, because I think that's what kind of freaked people out 20 years ago. So can you kind of simplify that for us a little bit? Where are we now with that understanding?
So because we only have this one study that's ever really been done on hormone replacement on such a vast number of women, the risk that that study shows that less than 20 women in 10,000 will have an increased risk of breast cancer with that particular form of hormone replacement, which at the time was something called Prempro, that number's not high enough to really tell like a whole population that they can't take it. So I think I'm back to the same thing where it's really an individual choice. Like if someone had like a personal history of breast cancer or had other risk factors that might make them, make their risk higher, maybe they would be less inclined, but really the tricky part is the benefits are also hard to quantify. So it's a very subjective sort of choice to take it.
Great. One of the questions is, should everybody in perimenopause be on HRT? What do you think?
So I think the main message about HRT is there are no more guidelines saying everybody should do one thing or everybody should do another thing. Everybody's potential benefits are different because everyone's perimenopause is so different, right? Some people feel great and don't have any problems. Some people feel terrible. They have terrible hot flashes, irregular periods. And so it really just depends on what's going on. And the hard part of it is that everybody's different, and a lot of the symptoms that people have are really, really hard to quantify. But, my general practice is really, if you want to figure out what the benefits of hormone replacement are, you could try it for 2 to 3 months. I think women tolerate like a lot of discomfort, and we're used to it our whole lives, our periods, pregnancy, childbirth, the whole thing. So there's a certain amount of, oh, it's fine, sort of thing. So I feel like there's no harm really in a trial of hormone replacement. That's decided on between you and your doctor, like what would be appropriate in terms of dosing and delivery system and all that stuff for like 2 to 3 months. And that's a good way to assess whether the benefits outweigh the risks for that individual person.
Great. So what other medicines can people use during menopause to like suffer less of the symptoms but that are not HRT?
So it depends on what the symptoms are. There are a lot of over-the-counter estrogens. Vitex berry is actually a good one for hot flashes. There's a product called Rolizin for hot flashes that's FDA approved. There are vaginal moisturizers that are good for vaginal dryness. There's Serenol for, hormone-related mood swings. There's a lot of over-the-counter things that people can try that don't bear the same risks as full-on HRT.
And that leads into like all these new platforms online that are kind of providing those things. How do you feel about the platforms that are providing those alternatives for women with menopause?
I think they're great. I think increased access to choices and is always great.
Okay, great.
So I actually have a lot of patients who are taking collagen, and I'm so curious about what the benefits are of taking it.
So I did a piece for the Today Show about this, and while the science is like completely lacking, and even the scientific theory of like taking collagen doesn't make any sense for skin, I do have one patient who I walked in the room and I was like, oh my God, your skin is so much less dry. Are you moisturizing more? And she's like, no, I'm taking collagen. So that's like one person who showed me like maybe it does help. But if you think about taking collagen, your body actually digests it. Hi, puppy. Your body is digesting the collagen, breaking it down into amino acids, getting absorbed back into the body, going all the way to the skin in these forms of amino acids, and then being made up into these collagen fibers again, which are pretty complex. So it's not like you're eating collagen and it's going right to your skin. So I'd say indirectly it's fine, but it could also just be a waste of money and time.
Is there topical collagen?
topical collagen will not penetrate through the skin, so that's where you get into all the anti-aging stuff, but LED light does penetrate through the skin, and that's where the science really is now. So we did this study with green LED light, bypassing the skin barrier, chemical free, easy on you, doesn't feel like anything, but what it does is hits the mitochondria and increases the collagen production in your skin. So we have that proven now. So green LED light with our sphere is something that we're really excited about. So that makes a lot of scientific sense.
Sweet, I'm getting out my sphere.
You have it. Cool. I love this question because I suffer from it too, which is menopausal acne. And so I have this new acne that I just cannot get rid of without understanding better, like, why is it happening to me? And so it's like an acne rosacea that is happening on my central face. And I talked to Dr. Chen about it for myself because I am on HRT. I've been on it since September because of hot flashes, and also I wanted to build up bone strength, so those things mattered a lot to me. And since then, my breakouts have been increased, so you gave me some options for altering my HRT to help with my new acne. And another beauty hack that I just learned about that was just published is using old-fashioned Afrin nasal spray, but spritzing it on your skin, on top of your skin, to cause vasoconstriction to help prevent some of those progesterone-related acne flare-ups. So that's a good beauty hack.